This tablet is a combination of B vitamins that are essential for treating or preventing vitamin deficiency caused by a poor diet, certain illnesses, alcoholism, or during pregnancy. These vitamins are important for maintaining good health and are essential building blocks for the body. Some brands of B vitamins also contain additional ingredients such as vitamin C, vitamin E, biotin, or zinc. It is recommended to consult your doctor or pharmacist if you have any questions about the specific ingredients in your brand. It is best to take this tablet as directed by your healthcare professional, and the optimal timing for taking this tablet may vary depending on your individual needs. When taking FAB-CMP, Cerise Bran-Rose Hips tablet, it is usually recommended to take it once daily or as directed by your doctor. Make sure to follow all the directions on the product package. If your tablet contains vitamin C, be sure to take it with a full glass of water, unless directed otherwise by your doctor. If you're taking chewable tablets, be sure to chew the tablet thoroughly before swallowing. For extended release capsules, swallow them whole and do not crush or chew them, as this can increase the risk of side effects. If you're taking a liquid product, use a medication measuring device to carefully measure the dose and do not use a household spoon. Some liquid products may need to be shaken before each dose, and those containing vitamin B12 may need to be placed under the tongue and held there before swallowing. Be sure to follow the label directions carefully to get the most benefit. It's important to take this medication regularly to get the most benefit from it, and to help you remember, take it at the same time each day. If you experience mild upset stomach or flushing, don't worry, as these effects are usually temporary and may go away as your body gets used to the product. However, if these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to note that your doctor has determined that the benefits of using this medication outweigh the potential side effects. In fact, many people who use this medication do not experience any serious side effects. While a severe allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects. If you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. As for the best time to take this medication, it's always best to follow your doctor's instructions. And for any concerns about side effects, be sure to consult with your healthcare provider. Before taking FAB-CMP, Cerise Bran-Rose Hips tablet, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that can cause allergic reactions or other problems. If you have diabetes, liver problems, or vitamin B12 deficiency, be sure to consult your doctor or pharmacist before using this product. Chewable tablets or liquid products may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist before using this drug safely. Liquid forms of this product may contain sugar and/or alcohol, so caution is advised if you have diabetes, alcohol dependence, or liver disease. Be sure to ask your doctor or pharmacist about using this product safely. If you are pregnant, it's important to tell your doctor before using this medication. This product is safe to take during pregnancy when used as directed, and maintaining adequate amounts of folic acid during pregnancy can help prevent certain spinal cord birth defects. Always consult your doctor or pharmacist for details. This product passes into breast milk, and while there have been no reports of harm to nursing infants, it's essential to consult your doctor before breastfeeding. When taking FAB-CMP Cerise Bran-Rose Hips tablet, it's important to be aware of potential drug interactions, as they may change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with FAB-CMP Cerise Bran-Rose Hips tablet include altretamine, cisplatin, certain antibiotics, such as chloramphenicol, certain anti-seizure drugs, such as phenytoin, levodopa, and other vitamin/nutritional supplements. Additionally, this product may interfere with certain lab tests, possibly causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you use this product. When taking FAB-CMP Cerise Bran-Rose Hips tablet, it's important to follow the recommended daily dosage and take it at the optimal time for best results. Always consult with your doctor for the best time to take this medication and to determine the appropriate dosage for your individual needs. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. As with any medication, it's important to take FAB-CMP Cerise Bran-Rose Hips tablet as directed by your healthcare provider. This supplement is commonly used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. The recommended dosage for adults is usually 1 tablet daily, but it's best to follow the instructions provided on the packaging or by your healthcare professional. It's typically best to take this medication with food to help maximize absorption. Always consult with your doctor before starting any new medication or supplement. Remember to keep all your medical and lab appointments. It's important to note that this product is not meant to replace a balanced diet. It's always best to get your vitamins from healthy foods. B vitamins can be found naturally in leafy greens, other vegetables, meat, fish, poultry, and enriched breads/cereals. So, make sure to incorporate these foods into your diet as well. And as always, if you have any concerns about your vitamin intake, be sure to consult with your healthcare provider. If you happen to miss a dose of FAB-CMP Cerise Bran-Rose Hips tablet, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next one at your regular time. Avoid taking a double dose to make up for the missed one. It's best to stick to your regular schedule for taking this medication. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep this medication out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.